This is WASH News. Coming up, 5th National Basic Sanitation Stock Taking Forum held in Kumasi. Torrential rain renders over 200 homeless in the Brong Ahafo Region, and over 300 people affected with cholera in Yemen. My name is Jessica Gazy. Now details of the news. Minister of Sanitation and Water Resources, Mr. Joseph Ada, has asked all players in the water, sanitation and hygiene sector to streamline and bring their activities to conform to the national implementation guidelines of the community-led water sanitation developed by the ministry. He made the call in an address at the opening of the 5th National Basic Sanitation Stock Taking Forum held in Kumasi. Mr. Ada underlined the need for stronger collaboration between the sector players and the Environmental Health and Sanitation Directorate of the Ministry to ensure effective coordination and supervision of activities. The program was on the theme, 5 years of rural sanitation model and strategy implementation in Ghana, learning for scaling up now and beyond. Mr. Ada noted that Ghana had improved significantly low on sanitation levels compared to other services. He mentioned that the low practice of hand washing with soaps in homes, with uncontrolled disposal of fecal waste, poor sanitation and unhygienic practices has become major contributors to the many water and sanitation related diseases, including cholera, and encouraged stakeholders to collaborate with government to improve sanitation coverage. A chief of water, sanitation and hygiene of UNICEF, Mr. David Duncan, urged strong political will to address the challenges of poor sanitation. He said, with strong commitments by all key stakeholders, Ghana will make progress and change the menace. To other stories, more than 200 residents of Kumasi in the Brong Ahafo Region have been rendered homeless due to a torrential rainfall in the area. Residents of the town, which is situated between two rivers, had their belongings, money and domestic animals washed away by the rainwater. Kumasi Zonal Coordinator of the National Disaster Management Organization, Mr. Akwesi Magellan, in an interview said, residents have been suffering similar disasters since 2012 and have complained to government through the district assembly for the expansion of bridges and gutters in the town to ensure the free flow of rainfall, but all to no avail. He said the situation was also negatively affecting school children in the community, since school children could not go to school whenever it rained heavily due to the overflow of the rivers. He therefore appealed to government and other non-governmental organizations to come to their aid. And to the final story, over 300,000 people have been affected with cholera in Yemen in the past 10 weeks, with about 7,000 new cases reported each day. More than 1,700 death cases have also been reported by the United Nations. Although the daily growth rate and the overall number of cases has halved to just over 2% in recent weeks, and the spread of the disease has slowed in the worst hit regions, outbreaks in other areas has grown rapidly. The most intense impact has been in areas in the west of the country, which has been contested in a 2-year war between a Saudi-led coalition and armed Iran-aligned Houthi rebels. The war has been a breeding ground for the disease, which spreads by feces getting into food and water and thrives in places with poor sanitation. Meanwhile, the World Health Organization has said its response to curbing the situation based on a network rehydration point, and the remnant of Yemen's shattered health system has succeeded in keeping death rates from the disease low at 0.6% of cases. Now this brings me to the end of WASH News, but then a quick look at the headlines. 5th National Basic Sanitation Stock Taking Forum held in Kumasi. Torrential rain renders over 200 homeless in the Brong Ahafo Region, and over 300,000 people affected with cholera in Yemen. For more news, log on to our YouTube and Facebook pages at WASH TV channel. My name is Jessica Gazy. Thanks for watching.